Hey there, Empowered Tribe. It's Angela T. Moore. You're getting ready to experience the next episode of Empowered, a health and wellness podcast where I share my personal journey of health and healing, tips for mental and physical health, interviews with health and wellness experts and those bold enough and vulnerable enough to share their own journeys to empower you to succeed in yours. We know that life can be rewarding. It can also be challenging. It has its ups and downs, highs and lows. I learned that with a strong mind and a fit body, you are better able to grow through and grow from whatever life throws your way. My goal is to share journeys of health and wellness, as well as tips and information from extraordinary people all around the world to help you live an empowered life. My guest, Dr. Charles Bloom, is Health Alliance Plan's Senior Vice President and Chief Medical Officer, responsible for improving health, wellness, and access to care for HAP's member base. He leads clinical and operational programs in partnership with the region's healthcare providers to promote provider and consumer experience, manage cost of care, improve clinical outcomes, and mitigate health disparities within the community. In this episode, Dr. Bloom and I discuss prostate cancer and the importance of early detection and treatment. He emphasizes the need for man to engage with primary care providers, have regular screenings, and understand their risk factors. Dr. Bloom also addresses common concerns and misconceptions about prostate cancer, such as the impact on intimacy and the overwhelming fear of invasive tests. He highlights the importance of a healthy lifestyle, including regular exercise and a balanced diet, that are key to reducing the risk of prostate cancer. Dr. Bloom encourages men to take ownership of their health by taking better care of themselves and seeking the necessary screenings and treatments. I hope you enjoy the episode. So Dr. Bloom, you are Senior Vice President and Chief Medical Officer for Health Alliance Plan, otherwise known as HAP. For those that are not familiar with HAP, can you tell the listeners about what you do and who you serve? What is your role at HAP?
Absolutely. Thank you, Angela. It's nice to be here, and thanks for having me. So I am the Chief Medical Officer at Health Alliance Plan. We are a integrated health plan that is owned by Henry Ford Health System. So we're an integrated delivery model. We work with Henry Ford as well as the rest of the networks across the state of Michigan. We serve all lines of business, so that includes folks that have Medicare Advantage, commercial insurance, as well as Medicaid, and our duals recipients, or those individuals that have both Medicare and Medicaid. So we really serve all ages and all comers when it comes to an insurance platform. My role as Chief Medical Officer is to help ensure, number one, promote health and wellness, number two, manage health outcomes, experience, and then ultimately help our clients and our membership achieve their optimal health outcomes. And that's what's most important to me as the lead clinical officer for the health plan.
Okay. You know, prior to today's interview, you and I were talking about the fact that we've had a few opportunities to talk about various health issues, and we're going to be talking specifically about a health issue that affects many people, many men specifically. But before we do that, one of the things that I wanted to ask you, how long have you been with HAP? Because you and I have had a number of conversations.
Yeah, it's been a while. So I started with HAP in 2016, and just a little background. So I'm an ER physician by training. I trained here in Southeast Michigan. I'm from Southeast Michigan. Then I spent 10 years in Las Vegas before moving back home in 2012. I continued to work clinically all the way up through 2019, and then have been solely at the health plan now since 2016, as I mentioned.
Oh, wow. Okay. Time flies by, right?
It does. That's right.
Now, as I mentioned and kind of alluded to, you joining me today because we want to talk about an issue that affects millions of men worldwide. And that issue is prostate cancer. And ironically, prostate cancer is an issue that I've talked to a number of medical professionals on my radio show. I've actually talked to a couple medical professionals on my podcast, which is fairly new because I know it is such a significant issue. Ironically, in addition to my wonderful husband, we've been together for 35 years. I have two grown sons that are 30 and 31. And I want the very important man in my life to be healthy. And so I think knowing that this is an issue that affects so many men, I wanted to make sure that I create time and space to do that. So how common is prostate cancer?
Yeah, so number one, part of the reason, and thank you for reaching out to have the discussion, is we just came off of Men's Health Month, as well as Prostate Cancer Awareness Month, both of which were in June. So that's part of the push and the motivating factor to bring this back to the forefront. Of course, health in cancer happens year round, but as we think about, I'll say the rallying cry to help promote, number one, wellness, and number two, the screening opportunities, and then ultimately talk about the disease itself and then what some treatment options are. So prostate cancer is the most common cancer for men. There are a couple of significant risk factors. Number one is family history. So if you've had a father or a sibling that has had the cancer or the disease itself, you're at increased risk. Those with, I'll say, low fruit and low nutrient diets, those that are obese, and then Black males are significantly more at risk, number one, to develop the disease and to develop the disease earlier. So if we can get the word out and the awareness out, and frankly motivate men to seek, number one, and engage with a primary care provider, to have the discussion, have the screening tests that are available, and understand those risk factors. That's really what we hope to accomplish, is motivate the men in our lives to seek, number one, counsel, number two, advance their own health and wellness. And things like diet and exercise do significantly reduce risk, not only of prostate cancer, but essentially most cancers that affect men. And one other interesting fact that I think is worth bringing up, and I am as guilty of it as every man that I know, is that men are significantly less likely to engage with primary care providers and seek treatment, especially screening opportunities, than women. So it's really an opportunity for us to push those men in our lives, hopefully motivate those men in our lives to, number one, engage, and number two, have the discussions with their primary care providers, and then empower them as individuals to promote their own health and take ownership of their own health opportunities. So that's what I'm hoping to share and discuss a little more today.
Okay. Now, one of the things that you did mention is screenings, and I remember putting in a question that I wanted to ask you, because it does seem to me like the age at which screening is recommended for prostate cancer has changed since even I did the radio show. Is that true? Was there a change in our definition?
It has, yeah. So the screening approach has changed over the last couple of years. And even now we have different societies and different organizations that give us different recommendations. And that's why engaging with that primary care physician so you can individualize your risk is really, really important. So the American Cancer Society, especially in Black men, suggests that you start having those conversations at the age of 40. Now, that doesn't mean you necessarily have to have a test at that time, but it's to go over those risk factors, what testing is or might be available, and then when is it most indicated. The old way of thinking was everybody at the age of 50 gets a PSA test and a digital examination, which is an exam of the prostate itself. We've actually moved away from testing all individuals. And one of the reasons we've done so, that's the PSA test, is because it leads to a significant number of false positive results. So we end up doing testing and even treatments when they were unnecessary. So back to the differing recommendations. The USPSTF suggests 55 is the time to start screening and have the conversation around PSA. I would urge earlier. And as I mentioned, the American Cancer Society suggests starting at 50 for all males to have those conversations, and then the risk, benefit, reward of testing. And then those individuals that are at higher risk, so family history, obese, family history of other cancers, and or Black men, I would recommend we start that at age 40.
Okay, now what, I'm not a man and I don't have a prostate, right? So what experience should a man expect when he does a prostate screening?
Yeah, so it's really a discussion. So it's a discussion to go with your provider through those risk factors. Okay. So the obesity, the diet, the exercise, the family history. If there's a shared decision to say, hey, let's do that PSA test, that's a blood test. So that's a very simple blood test, just like a blood count. We used to, as I mentioned, do digital rectal exams. So that's actually a prostate exam. We do that much less common now because what we found is that there's significant false positives. So you can have an enlarged prostate, but never have a challenge or a problem with prostate cancer. But you ultimately end up having, again, testing that is unnecessary. The alternative to that is wanting to make sure you capture those individuals timely and early enough to be able to detect those cancers and then ultimately treat when those treatments are warranted. So that's why I say, and this is one of those, most of our screening tests are really explicit and I'll say more straightforward. Prostate screening is a little less so because the decision making is based on conversation with your provider based on those risk factors that I mentioned already.
Okay. Yeah. Thank you for the clarification. Now, as with many diseases, oftentimes a person's prognosis is worse because they did not catch the disease early or signs or symptoms of the disease. My hope today is by sharing the right information, we can prevent someone from getting a diagnosis in later stages because they missed the sign. So what are some of the early symptoms and when should an individual see a doctor if they're experiencing those symptoms?
Yeah, no, that's great. So aside from just the regular annual exams that I mentioned already, would advocate not only for prostate cancer, but for things like screening for diabetes, for high blood pressure, and certainly other disease states. With prostate specifically, if you develop symptoms that often happen at the age of 50 and beyond, but certainly earlier, you want to raise the red flag. And that's if you're getting up in the middle of the night to urinate more than you used to, whether that's a more frequent or a less, I'll say, robust stream. So sometimes you have a hard time finishing a urination, or you develop blood in either the in urine or in semen. That's another risk factor. If you feel as if you cannot empty your bladder, that's another concerning symptom that you may want to speak with your provider or should want to speak with your provider to understand. Could it be related to prostatic hypertrophy, which is the enlarged benign prostate? Is it potentially related to a prostate cancer, or is there another etiology or another source or concern to address?
Okay, gotcha.
So fairly simple around, it's really around urinary habits. And if folks don't understand, the prostate is a gland that literally sits at the base of the bladder. Mm-hmm. And the urethra from the bladder out through the penis is where the urine comes out. And so if you have an enlarged prostate, it's like a donut constricting on that urethra. So it makes it harder for the urine to come out, both in discomfort and that sensation of not feeling like you're emptying, or if you have a sporadic urinary stream.
Okay. Now, one of the things that, and in fact, I think you kind of alluded to it, because I have learned that in the many years interviewing medical professionals on my radio show about prostate cancer, that certain populations are at greater risk for prostate cancer. You did mention Black males. Are there other populations that are at greater risk for prostate cancer?
Yeah, regarding race and ethnicity, it's actually Black males are at the highest risk relative to other race or ethnic groups. We don't have a good answer or a good handle on why that is. There's many thoughts and potential opportunities to understand that. We don't have the answer, meaning we, the industry, do not know the answer to that yet. What we can do, though, is get the word out, get the message out. And if it was just a higher prevalence, we might be able to say, well, it's because we don't have engagement or a population is not seeking care or screening. What we do know with prostate cancer, though, and Black males especially, is that not only is the prevalence, so meaning more people have the disease, but it actually happens earlier in life. So that's where in my opinion, the red flag needs to go up and say, hey, I'm a Black male, age of 40, I need to start thinking about this as a potential concern. It's a very treatable problem. Certainly there's discretion and folks often don't want to talk about things like urinary symptoms or flow or reproductive issues. So understand that that's another challenge to overcome. But it really is a treatable disease in most instances if it's found early. And that's where I think you were heading with the treatment opportunities. We really do have an opportunity if we can educate, again, the males in our life, that all we got to do is start down that path. If we are unfortunate, if we're the individual unfortunate to have the disease, again, if we catch it early, it really is treatable.
Now, interestingly, I have interviewed Dr. Michael Lutz on several occasions on my show.
Oh, great.
Yeah, and one of the things that he said is that males are more likely to die with prostate cancer than they are from it. What are your thoughts?
Absolutely the case. Yeah. So the number of individuals that have prostate cancer and ultimately die from it is significantly less than most other cancers. And as we talk about screening, and we talked about the low end of age group screening, we actually stop screening at the age of 75 for the most part. And the reason is that the treatment and or the symptoms are expected to outlive, the cancer is expected to outlive your life or your life expectancy. So I think that's what Dr. Lutz was referencing, is that sometimes we actually diagnose somebody with prostate cancer and we do nothing. We actually just watch it because it's a very slow growing cancer, depending on the location, depending on whether it's local or whether it's spread. Sometimes the treatment is actually to just sit and watch. And in fact, I have a close friend here at work who's had a recent diagnosis, and that's exactly what they're going to do. They do surveillance every 6 months, see if things are changing. It's a slow enough growing cancer that he has that as long as his symptoms are under control, the treatment right now is hurry up and wait.
Gotcha. Do you believe that many men are reluctant to look into their prostate health because they're concerned that that they are going to lose the ability to be intimate?
Absolutely. Mm-hmm. So I think there's a couple of things, and that was my comment about discretion. So number one, most folks don't want to talk about their urinary symptoms if they have them. Mm-hmm. Most folks don't want to talk about reproductive concerns if they have them. And then I talked about the digital rectal exam. So there's this notion that in order to diagnose prostate cancer, you got to go through a rectal exam, and who wants to do that? Mm-hmm. And then the notion of treatment, right? And so there are real risks as we get to treatment around the inability to maintain a healthy reproductive lifestyle. There's also concerns about loss and control of bladder symptoms. So those are real concerns on the treatment side. I would say those same concerns exist if you actually don't diagnose the disease early enough when it is treatable, and then you might ultimately have those exact same symptoms or worse, in addition to other life issues on top of that. So yes, I think the question or the concern about discretion is real. I think there's a stigma. Certainly, I know, even with my friends and people that will ask me some of these questions that they don't want to ask anybody else, is because of the discretion and the intimacy concerns.
Mm-hmm, mm-hmm. Yeah. As I mentioned, I have this wonderful life with these, wonderful men. I'm surrounded by my husband and my beautiful, I can't call them boys because they truly are young men. And I hope that, especially for my children, my husband and I have a wonderful communication, which is the reason why we've been together for so long. My hope is that when my sons, as they age, that they are proactive as it relates to their health. I've tried to lay a good, healthy foundation and really emphasize the importance of taking good care of yourself and getting your screenings and going to the doctor on a regular basis. I hope that they heed that and that they continue to take good care of themselves. Because the thing I would hate, Dr. Bloom, I would hate for someone to work hard and to accomplish well, to try to be successful in life and to get to a certain point in your life and then not be able to enjoy it because they didn't get a screening, or because they didn't go to the doctor.
Yeah, and it's an interesting dynamic and I mentioned already that men are less likely to seek medical care, especially related to screening, than women. There's an interesting dynamic as you think about heart disease. The opposite is true. So hopefully it doesn't sound as if it's a sexist comment, but the more we can get the men in our lives to take a few minutes, think about their own health, take a few minutes and be empowered. And if you ask any of us, of course we want to live a full, high quality, long life. And I'm guilty of it myself. I get busy. It's It's not easy. It's kind of a pain to make an appointment and to get yourself there. And I have other things to do. That's human nature. Very much appreciate that. But there's also that if I just continue to plug along, it doesn't affect my daily life. It's 5 minutes of my life in the middle of the night, or it's 5 minutes here, 5 minutes there. Often we're guilty of putting that off until the problem becomes bigger. So I appreciate the question and the concern, and I'm guilty of it myself, and continue to think about, how can we motivate the loved ones in our life? How can we motivate, in this instance, the men in our life? It's not that difficult to literally engage with a provider, have the conversation. Often it's much less invasive than we think. It's literally a conversation and or a blood test. And if the digital examination is what's holding you back, have that conversation with your provider. And I think you'll find more often than not that you can have plenty of other options and other examination tools that if that's the barrier, then move beyond that. I'm an ER physician in my past life. It never goes as planned. It's never as easy as you think it will be. So you take what you know, you take what you can do, and then you do the best with the information you have. That's my urge to your audience, again, for the men that are listening and for the men that aren't, that your audience may go urge is, it's not that hard. It really isn't. Get over the idea that you might not want to have an invasive test, or you worry about what the findings are. It's a whole lot better to find that out on the front end and potentially treat if there's something to be treated, or the ability to say, hey, no, you're fine, and think about the weight off the chest or the weight off the shoulders when you have that conversation with your provider to say, we're great, we're going to move on, and we'll reassess in another year.
You mentioned treatment, and that's something that we haven't talked about. What are the treatment options for someone who's received a diagnosis of prostate cancer if it has to be a more aggressive treatment?
Yeah, so I don't want to get out too far over my skis on expertise, and that's where urologist, if you in fact have the diagnosis, or your primary care physician, will be the one to help with significant detail. But there's a number of treatment options depending on staging, location, number of areas of biopsy, or if they're spread or not. But radiation is the most common, and that can be either direct beam, so that's where you go into the radiology clinic 5 days a week. They can also do what's called seed implants. So they actually put radiation seeds right into the prostate one time and you're done. Sometimes chemotherapy, so that's the medicines either orally or through the IV. Surgery would be another. And then lastly, often it's do nothing. It's just monitor and watch. So you have a pretty wide range of potentials there. Again, I happen to reference my friend who was just recently diagnosed. You hear the cancer word, right? Everybody jumps right to what the negative connotation or the negative concerns that brings. Understandable, rightly so. I all would do the same. But this is one of those disease processes, again, that number one, treatable. Number two, the treatment options. There's usually more than one, and it's often less invasive and less impactful than many of us are concerned. So again, I'm more urging and hopefully motivating that don't let the idea of what could be your barrier to engage, have the conversation, screen, and find out what you potentially do or don't have to worry about.
Okay. Now, I will say this. Anyone that knows me know I'm a big advocate of education, even more a greater advocate of prevention. We've talked a lot about prostate cancer. We've talked about the populations that are more affected by prostate cancer. I would love to, if you can, provide some preventative measures that men can take to help prevent them from getting prostate cancer and have to even get that diagnosis in the first place.
Yeah, that's where we all should be, right? And it's really simple. I wish I had something that was really specific or unique to prostate cancer to share in something great, but it really is health and wellness. So are you doing regular exercise? Are you managing your weight? And diet really does matter. And prostate is one of those cancers that poor diet, sedentary lifestyle, obesity lead to increased incidences of prostate cancer. So especially as you think about, I know you referenced your sons being young men, couldn't be a better time in their lives if they're not already thinking about that promotion of that health and wellness. And it means, potentially just walking once a day, a couple of times a week. It doesn't have to be you go to the gym and get your heart rate up to 100 and 180 beats per minute. Of course, we want to push the envelope a bit on exercise, what that might mean. But resistance training, movement, and lack of sedentary lifestyle are really key, and then diet. And we're all guilty, and there's a number of studies. I know you've done a lot of work on diet and exercise on your programs, but our diet in this country, we've seen significant increased rates in obesity among our children, among our adults, and it's happened over the last 20 to 30 years. So it's not as simple as you as an individual just making choices. It actually is a little harder to make those choices because when you go out to eat, when you go to the grocery store, you have to be very deliberate about the choices you make and what's convenient and what's available. It's harder to eat healthier, in my opinion, now than it was 20 or 30 years ago. So there has to be a deliberate approach to what we eat, and high fruit, vegetable diet, lean meats and lean proteins, certainly to augment that would be the diet recommendations, and at the very least light to moderate exercise to maintain adequate and appropriate weight. And that's not just for prostate cancer. As we think about chronic disease and avoidance of things like the diabetes that I mentioned already, like hypertension or high blood pressure, they are related, even though they're separate disease processes.
Mm-hmm. Yeah, I remember interviewing Dr. Sophia Mariva from the University of Michigan Rural Cancer Center like many years ago. Probably she was one of my earlier guests when I first started doing the radio show. And she would talk about, she would really emphasize that regardless of what the disease is, regardless of what the diagnosis is, integrating those healthy lifestyle strategies is going to make your life better anyway. And one of the, go ahead.
It will. And yeah, I know you feel strongly about the mental component, not only the physical. And we all know it's hard to get off the couch. I live it every day. I've got really busy days. I've got 4 kids. It is so hard to find the time to sneak in a workout or to eat deliberately and eat less and eat more appropriately. So very much appreciate how difficult it is, and especially with all things that are around us, like fast food and convenience. But it really is, and we talked a little bit before coming on air, you certainly have different life events and different motivating factors. But I hopefully this conversation might help 1, 2, 3, maybe hundreds of folks to say, hey, wait a minute, let's just get off the couch and let's get going. And start small, that's fine. But my point to beginning of that was the mental component. So if any of you or your listeners have done it and like me in a roller coaster, you definitely feel better, you sleep better, your mental approach is better, even though it's hard to get started. So my urge would be just start small and see where it takes you.
Small steps is to taking the first step is you have to take the first step to get started. And absolutely. And I will say, Dr. Bloom, it's been my experience that a lot of people overcomplicate nutrition, overcomplicate exercise. And I think that's because it's set up to be complicated. The messages are very, they're not consistent. We are historically, we are a country of fads and fad diets and, what's popular now versus, what was popular before. I think, and I will say also too, I have recognized that certain industries will push certain types of food. And so from, a commercial perspective, sometimes certain foods are pushed that are not healthy for the individual just because it's profitable for the industry. So I think though...
No doubt. And that changes where you live and the activities that you engage in too, right? So there's another whole layer there that...
it's okay.
And I didn't mean to interrupt you, but as I know that the program is Empower, we have to empower ourselves to take ownership. And as you mentioned, and I think where you were going was on the simple side, it is as simple as eating fruits, vegetables, lean proteins, exercise is as simple. You don't need a gym membership or a Y membership. I mean, squats, push-ups, planks, literally walking, all of those things you can accomplish in your home without paying a dime for any gimmick or any external membership or tools. Literally, push-ups, squats, leaning against the wall with your legs bent. Very simple activities can help get you down that path.
Now, one of the things that I wanted to do before we end today is I want to give the individuals that are going to be motivated and inspired to take action access to resources. I do know that HAP is very good about providing resources to their members and just information in general to the individuals that will benefit most by attainment of that information. Where can people get access to resources and information specifically about what we talked about?
Yeah, so there's a number. So we, you can come right to us. So our members, and even those that aren't our members, we have our online resources that are really easily available. That's less risky. You don't have to talk to somebody. You can just peruse and take it at your own pace. We have a number of community partnerships and relationships for food, for exercise. We actually have some benefits built in that help support premiums that you might have to pay at a gym membership. So depending on what plan you have or what plan, if it's an employer group, what they cover, but we can help guide down that path where it isn't necessarily something that has to come out of your pocket. It isn't necessarily something that you have to pay for or go chase. We can help facilitate what some of those resources are directly. The other is we have a number of community events that we sponsor with local churches, local health departments, is some of the screening mechanisms, and that's usually around things like diabetes, blood pressure, weight, diet, things like the PSA test that we're speaking to on prostate is really engaging with a provider. So that's where I'd say the best case scenario out of any of that is engaging with a primary care physician. I do believe completely in the medical home, meaning that you have one provider that's the captain of the ship that you can develop a relationship with. If you can find one that you trust, they trust you. I think, and in fact, there's good data to show that your longevity is 7 to 8 years longer, I think was the stat that I read recently, that for those individuals that have a continued trusting relationship with their primary care physician, live significantly longer than those who don't. So that's where I would say that the panacea would be is, are we able to find a provider that we trust, a provider that can help us and have those discussions, not only for prostate cancer and screening that we talked about already, but general health and wellness. And there's a number of other screening opportunities for things like colon cancer, like the diabetes and hypertension potential opportunities.
Okay. And if anybody wants to look up information regarding some of the things that you referenced, would they just go to the website?
Yeah, it's just hap.org. So very simple. So Health Alliance Plan, which is HAP. So hap.org. That's our member-facing website, so anybody can access it. You don't have to be a member. You don't have to have a login or an ID. For those of us that are HAP members, there is an opportunity to develop your own account, to log in as yourself, and there's actually continued or further resources for those individuals there, and specifically around some of the rewards programs or the wellness programs that are specific to their benefits.
Perfect. Well, I want to thank you so much, Dr. Bloom, for once again sharing your knowledge and wisdom with me. You're always such a great person to have as a guest. You always provide such wonderful information in a way that I think it can be received, and that's most important. So thank you so much for taking time out of your day to do that for me. I really appreciate it.
My pleasure. Happy to be here, number one, and thank you. I'm sure your listeners will know it even better than I do, but you do amazing work, and you really, I love the message of empowerment, and I talk to my kids all the time about it. So
you're very welcome.
Thank you so much.
Thanks for listening to Empower It with Angela T. Moore. Feel free to share this episode with someone you think would enjoy it. New episodes come out weekly. Follow our show on Apple, Spotify, YouTube, or wherever you're listening right now.